Autism Spectrum and the Diet Connection by Christina Rieger, prepared for Integrative Seminar 2 with instructor Teresa Trescritti. I'm sure you have heard that we are what we eat. The food we consume will drastically affect the growth and development of a child from conception throughout childhood. The gut has also been called the second brain, as nutrition is very vital in the treatment of autism spectrum disorders. A number of medical, nutritional, and vitamin-based treatments have been shown to not only improve symptoms with autism spectrum, but also address some of the possible underlying medical and biological causes of autism. What is autism spectrum disorder? Autism spectrum disorder was first described by a psychiatrist, Leo Kanner, and was one of the first physicians to recognize and describe the then emerging condition that we know today as autism spectrum disorder. Autism spectrum disorder is a neurological disorder that is typically described and diagnosed in children between the ages of 3 and 6 years of age, and sometimes as young as age 6 months of age. The history of autism, again, was first described by a Jewish physician, Leo Kanner. It has been 50% increase in the incidences of autism spectrum disorder between the years 2002 and 2006. Common symptoms of autism spectrum disorders might include social skills, interactions and communication, delayed language development, aggression, repetitive motions, or stimming, and a narrow range of interests. They might have issues with touch, smells, light, sounds, and might experience learning disabilities. No single cause has been established, although genetic and environmental factors are thought to play a huge role in autism spectrum disorders. There is growing evidence and concern that nutritional changes can substantially make a big difference to children with autism spectrum disorders. The neurotransmitters in the brain have receptors in the digestive tract, and there are receptors in the brain for the hormones found in the gut. Not only can the gut affect the brain, but the two communicate with each other all the time. We have all heard the saying that we are what we eat. The goal of nutritional changes in autism is to support the structure and function of the child's developing brain and body, and to be able to perform at their optimum level, and to maximize the child's brain function so that the response to other treatments is improved. Proper nutrition and diet should include avoiding food additives, preservatives, and avoiding toxins at all costs. Avoiding yeast products that can be found in gluten, such as wheat and specific kinds of bread. A number of medical, nutritional, and vitamin-based treatments have been shown to not only improve symptoms, but also address some of the possible and potential underlying medical and biological causes of autism spectrum disorders. Together, these treatments are called the biomedical approach. Records gathered by the CDC show that an estimated 1 out of 88 children in the U.S. including 1 in 54 boys are diagnosed with autism spectrum disorders. This represents an increase from 600 to 1,000% over the last 2 decades. Autism spectrum is quickly becoming an epidemic, and it is necessary and very crucial to find out why this is happening to our children today. Genetics do not create epidemics, and autism is not thought necessarily to be a genetic disorder, but toxins that we consume in our food and from our environment can alter changes in a growing body and brain due to what people are consuming. Some of the major systems affected by autism spectrum disorders are digestion, detoxification, and the immune system functions. Poor nutrition will aid in the decline of these body symptoms and systems. Poor digestion contributes to nutrient deficiencies and creation of food sensitivities, leading to other and further inflammation and digestive problems. Bacteria will affect the brain and production of opiates from our food that affect the brain and bodily functions. And autism spectrum disorders are regulated from the brain, as it is known as a neurological disorder. Toxins in our food and from our environment cause inflammation in our brains and vital bodily systems, rendering them weak and susceptible to disease, disorders, illness, and complications. It is very important that we avoid such drugs, chemicals, modified foods, and toxins that could have toxic side effects on our bodies and brains. Yeast overgrowth is also an issue with autism spectrum disorders, where yeast will grow and cause bacteria in the intestinal tract. Removing gluten, casein found in milk, and sugars that cause overgrowth in the gut from yeast is very important to remove from the diet of an autistic child. This is a clip art slide that shows some of the history and key players in the history of autism spectrum. The term autism spectrum disorder has only been in use since the year 1987. It is said that symptoms can drastically decrease by changes in the diet of a child with autism spectrum disorders. Some of those changes can include behavior, skin rashes, language development, intestinal issues, the ability to make eye contact and ability to focus, their aggression level, sleeping difficulties, and issues with toilet training. There is growing evidence and concern that nutritional changes can substantially make a big difference with children with autism spectrum disorders. Many have severely disruptive digestive patterns, so restoring balance in the gut is a major focus for nutritional therapy. Western medicine has been in the business of treating disease rather than preventing it. An attitude of prevention is the first line of defense. Autism costs families an incredible amount of money, and estimates range from $60,000 to $100,000 per year, and that assumes that you can either find an adequate public school in your district or pay for private school if your city will not agree to pay for it. My husband, who works as a registered behavioral technician using applied behavioral analysis, has told me many times that if there was proper discipline in the home, consistency along with proper diet, quite a few behavioral issues he sees daily with his clients would greatly diminish. One child consumes pizza almost on an everyday basis. This in itself is unhealthy and full of gluten and lacks nutritional value. His behaviors are often off the charts some days and seems to have a very poor diet. He has severe stomach issues, going to the bathroom, and being constipated. When my husband worked with this same child in the home with his father, as his parents are divorced, he recognized considerable growth and stability in his behaviors and learning patterns when he was eating a better balanced diet, which very rarely consisted of pizza. When he returned to his mother's home after being with his father all summer, his bad behaviors started to return because he was not receiving a good diet. My husband also noted that he noticed a considerable difference between his bowel and stomach issues between locations, as he could see that the better diet contributed greater results in the therapy sessions alone. This particular child seems to act out with poor behaviors due to him being uncomfortable with his stomach and gut issues from result of a poor diet. This slide shows items that we need to remove from our homes and from our diet to make sure that we are not exposed to toxic chemicals. We need to detox all of these items out of the home and diet. Food and diet are a very important part of our health, and 85% of everything we consume should be made out of fresh meats, fish, eggs, good quality dairy, vegetables, and natural fats. We need to religiously avoid all processed foods, soft drinks, and food additives. Especially with pregnant women, they need to make sure that they are not being exposed to toxic foods and toxic things within our environment that could damage and harm the fetus and the growing brain of the fetus. This is a clip art slide that I came across. Our brain and bodies are certainly affected by what we consume. We need to make sure that we are consuming the right amount of nutrients, minerals, and not polluting our bodies with chemicals, toxins, additives, preservatives, dyes, and the list goes on and on. We need to make sure that we fuel our bodies and minds with the proper foods that will nourish our bodies and not tear them down. This slide just contains important nutrients for a developing brain of those children who have autism spectrum disorders. We do become what we are eating. This slide just contains part 2 of the nutrients needed for a growing brain with a child with autism spectrum disorders. One item to avoid with a child with autism spectrum disorders is soy. This item will block thyroid function, it will irritate the gastrointestinal tract, blocks absorption of some important needed nutrients such as calcium, magnesium, iron, copper, and zinc. It is not a good substitute for the replacement of dairy products, and it is not easy to digest. Some of these listed on this slide are helpful autism spectrum supplements. They include probiotics such as acidophilus, which aid in digestion and help reduce gas and prevent loose stools and diarrhea and increase food utilization. Others such as magnesium and a B6 help to increase use of speech and verbal communication, improving sleep habits, decrease in hyperactivity and irritability, and better attention span and interest in learning. Others include zinc, vitamins A, C, and E, amino acids, and DMG, which is classified as a food and helps to enhance the effectiveness of the immune system. It also improves the physical and athletic performance of humans and animals. DMG can be found in small amounts in specific foods, and it can be purchased over the counter at many health food stores. DMG has been used for many years with autistic children, and most have observed a remarkably good results in areas of speech and better improved behavior and eye contact. Frustration levels and tolerance have increased. A healthy diet contains whole foods, good fats, and the right amounts of cholesterol for brain development, organic and grass-fed meats, foods that are unprocessed, and fermented foods that are rich in probiotics that will help aid in digestion and cut down on the amount of bacteria that is found in the gut. Two children diagnosed with autism spectrum disorder can act very differently from one another. Autism is very complex and involves a spectrum of changing behaviors that can vary. Neuropaths and nutritionists have been saying for years that autism may have something to do with the environment in addition to genes, and that is why children need to be consuming good foods that can play a good part in their health and development. The goal of nutritional changes in autism is to support the structure and function of the child's brain and body to be able to perform at their optimum level. Nutrient deficiencies impact mood and behaviors, often increasing anxiety and stress. The most commonly known symptoms include inability to focus, ADHD and autistic behaviors, depression, mood disorders, irritability, and lack of motivation. It is important to chart progress when changing diet of that of an autistic child. It is important to keep record of the diet, seek help from a nutritionist or dietitian or qualified physician, look for improvement in patterns, add one food at a time, and avoid changing foods and supplements abruptly. Watch for symptoms of regression. Sometimes regression is actually a sign of healing. An example of this might be the removal of gluten or casein from milk, which cause an opiate withdrawal. I'm reminded of a song from one of my favorite bands, Petra, and a song that they wrote many years ago called Computer Brains. This song actually spoke of garbage in and garbage out. This, I feel, relates even to our diet, and if we take in garbage, we will be suffering from diseases and disorders, which seems to be a growing epidemic in our society today. We also need to take into consideration that our bodies were given to us by God. We are made in His image, and we are told in the Bible that we are to take care of the temple and body that He has given us. This includes making sure that we eat the proper foods and that we take care of the body that God has given us at all costs. Nutrition is certainly a piece of that puzzle with our health, for that health-wise and our spiritual life, and that in the life of an autistic child. We are what we eat and consume, both physically and spiritually, and what we put into our bodies will affect our cells of our bodies, minds, and our spirit. the very air that we breathe and chemicals that we use, even the people that we share our lives in space with, all of these things are taken into consideration and are broken down and remade into the person that we are right now. There is growing evidence that show that many children who exhibit autism spectrum disorder symptoms have also been treated with large amounts of antibiotics. Antibiotics kill both good and bad bacteria in the gut. Also, many children with autism spectrum disorders have what is called the leaky gut syndrome, which causes issues 9 out of 21 autistic patients. Leaky gut is when peptides enter the bloodstream and cause harm. The structures of peptides remaining after digestion react at certain sites in the brain called opioid receptors. Named this because these sites are where the opiate drugs such as morphine and heroin act. As we would expect, these opioids may radically affect behavior, cognitive abilities, emotions, pain thresholds, and even sound sensitivity. Too many times in our culture and society today, it is treat the symptoms rather than fixing the cause. The goal of nutritional changes in autism is to support the structure and function of the child's brain and body to be able to perform at their optimal level. It is very vital and important to keep balance in the gut and to focus on nutritional therapy. This includes making sure that an autistic child gets the proper nutrition needed for growth and brain development. This photo is a clip art slide that I came across that shows the parts of the brain that are affected by autism spectrum disorders. Eating healthy is important for anyone, but it is especially important for an autistic child. No dietary approach will help every person who is diagnosed with an autism spectrum disorder. This is just one area that has been researched that seems to play a huge role in the symptoms and treatments of autism. Many families have reported improvements in behavior and language as a result of special diets, including elimination diets that remove gluten, a protein in wheat and related grains, and casein, a protein in milk, and also removing certain additives and preservatives. Gluten is a protein present in grains, mainly wheat, rye, oats, and barley. These proteins do not get digested properly and turn into substances with similar chemical structures to opiates, such as morphine and heroin. Yeast overgrowth is also another issue found in studies done with children with autism spectrum. Yeast causes a large amount of destructive bacteria to grow within the digestive tract. And these bacteria are then secreted into the rest of their body, causing health issues and other related disorders, those commonly found in autistic children. What happens in the womb lasts a lifetime. The abnormal growth starts early in life, even in the womb. A study was done on umbilical cord blood of 10 randomly selected new mothers in 2004, and a shocking number of chemicals and pollutants were found. tests detected 287 different toxic chemicals, including mercury, flame retardants, pesticides, just to name a few. These are scary statistics, and these are apparently items that we are ingesting from our environment and our foods, and they are affecting the children being born today more than ever in the growing epidemic of autistic diagnosis. This is a clip art slide that I ran across that shows some potential hazards and dangers to pregnant women that could potentially harm a growing fetus. Autism used to be a rare disorder, and the majority of doctors never saw it in their practices. But now today, according to the United Kingdom Department of Health, 1 in 150 children in Great Britain were diagnosed with autism, and the USA Centers of Disease Control, 1 in 150 American children are diagnosed with autism spectrum disorders, and the numbers are growing larger and more every day. Why is this happening? The truth is, we are not sure. However, we do know that genetic disorders do not show such a sudden increase or incidence. Genetics just don't work that way. This kind of increase in new diagnosis of autism cannot be explained by genetics. On the contrary, it provides a very strong argument to support the statement that genetics may not play an important part in the development of autism at all. This means that most likely that diet and environmental issues could play a huge role in autism spectrum disorders and the treatment and finding a cause of why this is happening to our children today. Hippocrates stated that all diseases begin in the gut. There are neurotransmitters and neuroreceptors in the gut that correspond with those that are in the brain. Dietary treatment coordinated with other treatments need to be used to reduce the maladaptive behaviors that are seen with that of children with autism spectrum disorders. Evidence has shown that toxic chemicals in the environment can damage the human brain and produce a number of neurodevelopmental disorders, including autism. The brain and GI tract are very susceptible to damage from oxidative stress. If we focus on results, we will never change. So we need to focus on change so that we can get results. A change in diet is one method that is noted to make some changes within the behaviors and issues that are being seen with autism spectrum disorders today. Gastrointestinal issues are very prevalent with children with autism spectrum disorders. Working with a registered dietitian is a very vital component in the wellness and treatment of autism. The Bible also tells us that we are to renew our minds and be careful and monitor what we put into our bodies and minds. We need to eat right and feed our body with the right food and our souls with God's Word. No diet can cure any disease. Only God can heal you. We can help stay well by respecting the body that He has given us, by consuming the right foods, and by being in His Word, growing spiritually. According to one survey of 1,800 autistic children, revealed that 65% of them showed improvements and various symptoms when changing foods within their diet. What we are consuming today seems to be more contaminated than in years past. Whether a child develops autism is dependent on how exposed he or she might become to our toxic environment and foods being consumed, even from birth and in the womb. Environment, general good health, diet, as well as genetics and family history all are being taken into consideration and need to be figured into the equation for causes of autism spectrum disorders.